the Brigham and Women's Health Information Technology CERT has focused on using information technology to improve the safety and efficiency of the ways that we use medications. We have been working on medication use for some time in the CERT, and even before the funding for our CERT started, we did a lot of the work that showed that computerization of prescribing dramatically improves its safety. We did that initial work in hospitals, and since then we've been able to extend that to prescribing outside the hospital. The initial work showed that when you computerize prescribing, it eliminates 4 out of 5 medication errors, and it cuts the chance that somebody will have a problem that's preventable that's related to one of their medications by about half. In part as the result of that, the federal government has put in place subsidies to get providers and hospitals to adopt electronic health records. And one of the most exciting things that's happened in healthcare over the last few years is that we've gone from about 80% use of paper electronic records to 80% use of electronic records. Now, that means that everybody is prescribing electronically, but whether or not they get benefit from those electronic records and from prescribing electronically will depend a lot on the help that they get from the record. And through our CERT, we've tried to work on this in a couple of ways. One is that we've tried to identify generalizable lessons for all electronic records about how you help people prescribe effectively. And those are all published, they're all freely available. And two, we've tried to figure out what the specifics are of how you should help support providers when they're prescribing medications. So we've gone through and looked at all the various types of decision support that we deliver. Decision support about allergies, decision support about drug-drug interactions. What we found there was that providers were getting far too many warnings about drug-drug interactions, and we identified and published a very short list of drug-drug interactions which you should basically never miss. Those are freely available to everyone, and they're being used in electronic health records across the country. We've also worked on decision support around patients with kidney problems. That turns out to clinically be one of the most important types of decision support that you can give. And then decision support about age, so that you get the right dose of a medication given your age. We've also worked on trying to find the providers who override warnings when they should not. One of the things that you can do after you've got people to prescribe electronically is you can track how often they're overriding. And we find that a small number of doctors actually routinely override even warnings that are very important. And we're working with those providers to try and get them to change that behavior. We've likened that to running stop signs. When someone behaves badly in a traffic situation, we work with them, and our society doesn't let people continually do that. In addition, we have focused on trying to use electronic health records in new ways. And the old way of finding patients who are having a problem with one of their drugs was to wait for them to report it to someone, usually to the federal government or to the manufacturer. What we're doing is we've identified a small set of drugs, and we use the electronic record to find patients who are getting those drugs that are either new drugs or drugs that we think are risky in some way. And we then contact the patient and ask them if they're having a problem. If they're not, we're done. If they are having a problem, we have them talk to someone, and we try and find out whether we think it's truly related to the medication. And that promises to help us find problems with medications much earlier than we were able to previously, and at much lower cost. So taken together, the Brigham and Women's CERT is focusing on figuring out how we use and leverage information technology to make giving medications, in particular prescribing of medications, absolutely as safe as it can be. And we've identified a lot of lessons that will be used by everyone in this country and abroad.